All right. Welcome back, everyone, to another episode of the Health Made Simple show. I am here with our host, Dr. Bart Precourt, who has been a healthcare practitioner for over 20 years, practicing a range of modalities, including chiropractic, acupuncture, kinesiology, functional nutrition and supplementation, and lab testing, all out of his clinic, Balance Health Studio in Seagrove Beach, Florida, as well as virtually on Zoom like this around the world. He's also the founder of the Health Edge program, which is a cutting-edge health program for entrepreneurs and executives wanting to take their health to the next level. And he's worked with athletes and celebrities all around the world. And tonight he answers your questions. We've already had a bunch sent in, which we love. So thank you so much. But we're going to start tonight with your clinical insight. So what have you been saying this week?
Yeah, so this week's clinical insight, and again, everyone, thank you for sending your questions in and whatnot. It's awesome. Keep doing your thing. If you're here with us live, welcome aboard. Love having you. Clinical insight. And so I think I wanted to start kind of do these just to share things I see every day, because they're so relative and so relative to the whole concept of our show, Karen, of making health simple. That oftentimes so many of our health challenges, we really make them a lot worse than they need to be. And today is really no different than many other days. And again, I'm always amazed. I've been practicing for 25 years and I still keep learning things in practice, or I see them differently, or they have just a new impact on the way I'm seeing them. So today, in these last couple of weeks, and I think a lot of this is stemmed from me recently having the knee injury I discussed here. Yes, which is every day is getting a little better, which is awesome. So I want to share with you a couple of cases today, everyone. And I think this is relative to everybody that is listening, whether you've had an injury, whether you've had a sinus infection, you're cold, you had COVID, just whatever it may be. And it's that we need more patience. We need more patience to heal. And I want to share with that. I want to give a real cases what that looks like. So case number one of the first people that I saw today. I saw her last Tuesday, it was 1 week ago, and she came in for her first chiropractic adjustment. I saw her years ago, but I saw her for the first time in years, and she came back in with what she describes a couple months of low back pain. And so, we do our thing. I got her adjusted. Everything went really good. She left happy, felt really good, et cetera. Comes back 1 week later today on Tuesday, first thing in the morning, and says, "Oh man, must be something else wrong. Can't just be what we talked about. Must be something else wrong. I've already got scheduled an ultrasound and an MRI."
Oh, wow.
Yeah. So, and listen, there's nothing wrong with doing extra procedures or extra diagnostics to figure out what's going on. Yet that conversation, right? So my first question was her, did anything we did it make you feel better? Did it help with your low back pain? Not that it had to, but did it? So yeah, felt great all the way until Sunday. In this, so everyone listen closest. If you do something and it makes it better, really what you need is more of that and less of whatever else you were doing.
Yeah.
Because your body never lies. So in this situation, listen, I'll be honest with you, I wasn't talking her out of it. So she was like full blown, there must be something else wrong here, not knowing what, other than if you start Googling, and I can only imagine what happens if you start Googling low back pain on Google, right? Like what's going to come up? And that's what got into her head. So therefore she's going to go down this rabbit hole. And I say this because listen, 25 years doing this, I'll tell you this, you're not going to go to I hate even putting it this way, but I'll just say this. We're not going to go to a medical doctor whose primary job is to reduce and remove your symptoms. You're not going to go there and then get you healthier. They're going to help you reduce and remove your symptoms. And listen, for some people, that's perfectly fine. There's nothing wrong with it, but it's a rabbit hole and you're going to get chased right down it because that just means medication and drugs. So that was number one. And that's just one of the ones I think that's real life, that people do things and they think it should be healed immediately.
Oh, one, and also lower back pain often, sometimes it can be obviously, an injury or you've done it or something, but otherwise it can be like you've been doing these movements that have not served your back for a number of years. You might need, a bit longer than one adjustment to be able to get some of this relief.
And that seems so obvious to anyone who's practicing health. And
Yeah.
that's what it really boils down to. If you're not practicing health and you're really practicing sickness avoidance, and you're only practicing, you're only practicing, I'll only take care of my body when it breaks down on me, that's totally different. You won't recognize that maybe it needs a timeout and maybe it needs some stretching, in this individual. And listen, no knocking it, because a lot of people don't take care of themselves. But when we went through the simple things like, do you do any stretching? Have you gained any weight over these 2 years? And it was just like, like all of the things going against our health was adding up. So again, in certain scenarios, it's not going to change. But I'm talking to the audience who's listening tonight, or who might be listening to this in a recording. When you think about your health, I promise you, making decisions in an emotional state is one of the absolute worst things you can do for any part of your life, especially your health.
Yeah.
It is always pump the brakes. Ask someone.
It's so hard when you're in pain. Like when you're in pain, you don't want to pump the brakes. When you're in pain, it's very difficult to then calm yourself down to think logically, as we
100%. So let me go to the two other cases, and it's almost like a repeat of this. So next dude, young guys, I can afford it. A good friend of mine, super high level jiu-jitsu guy. If he's listening, he's gonna yell at me tomorrow. I won't use his name. Super fit guy, man. Literally probably trains anywhere from 8 to 10 or 11 times per week. And has this thing that shows up on his back, like it hurts him, and it shuts him down for, anywhere from a day to a week at a time. And so sure enough, it happened again. And so his thought was to me, he's questioning me, man, do I have to stop training? And it's not a simple answer. It's not just a no. It's, hey, listen, it's not the training that is causing you your problem. You're out of balance. My analogy is, so he trains 8-10 times a day. A week. So if you're doing the math, you're like, well, there's only 7 days a week.
That's a lot.
There's many days he's doing 2 a day.
Yeah, wow. He's doing a lot of training.
A lot. And it's not the amount that is the problem. It's the balance. If you're doing this much. So I remember when my wife was in the on the Olympic team, they trained 4, 5, 6 hours a day. So never mind a week. I don't train 6 hours a week. They were doing it in a day. But all they did was sleep, eat, poop, and train. That's what they did. Yeah. So it's not the amount, but it is the other stuff, the balance. If you're asking that much of your body, are you giving back to it? Yeah. So, and that's it. So, well, listen, because I knew, just like when my knee got banged up, I knew it got into his head. And he started going through this thing, man. Do you think I have to stop doing jiu-jitsu altogether? I was like, no, brother, no. You have to be willing to give back to yourself. And this is where most people, man, until we're broken down. And I think there's a couple of reasons, and I'm going to go into these reasons. So we're going to go simple on this, like Health Made Simple show, Health Made Simple. Let's fix this stuff up and understand how we got to move forward. So same thing. It got into his head, an injury. And listen, we're going to get through the injury as long as he lets the healing take place. But if he doesn't get on the same side of his body, and he's mad and he's bummed out at it, and and all the negative thoughts going through his brain, it's going to be very, very difficult for him to heal. And then there's evidence supporting his negative thoughts. Yeah. Where, man, I might not be able to train anymore. He goes to try to train, he hurts it again. There's the evidence. And I see people do this all the time. So, well, I tried to come back, and man, running is no longer for me, or exercise is no longer for me, or yoga is no longer for me. Every time I do it, it hurts, man. It's not that black and white, and there's no one size that fits all. So again, patience, critical here. And then the third case, young girl, same thing, little maybe obsessive with training and workouts. Okay. I say young girl, just not quite 40, lots and lots of exercise, at least every day, hardcore stuff. And I don't know if it's all for the right reasons. Meaning that if I love exercise, and listen, I'm okay with a little vanity with our exercise as well, but knowing that, listen, I exercise sometimes because of my vanity. Like, I want to look better, but it's always secondary to feeling better and to functioning better. And I think when we blend all those three together, there's really no wrong answer. But if it's because there's a concept that if I don't work out, I'm going to gain weight, then we're kind of teetering on some other concepts that aren't really awesome. So same thing. Wouldn't slow down workouts. I take this back. Doing super hardcore workouts CrossFit type stuff. And again, nothing wrong with CrossFit, folks. Like CrossFit does not hurt people. People hurt themselves doing CrossFit. That's a real important distinction there.
Yeah.
So she moved to like Orange Theory, and now she's getting hurt in there as well. So what are you going to do? Start taking the intensity. The next thing all you're doing is walking, down the road. No, the idea is we got to elevate ourselves. We got to give ourselves, we have more patience with our body and healing. So same thing, doing about adjustment every 4 or 5 or 6 months, but training ruthlessly on our body. And again, not giving back. So super out of balance and not very patient with the body. So then when we're not patient, we get emotional and we start thinking for ourselves, we get in trouble. So let me flip it over. So what do? Let's just say that if you're human and you really like having your body feel good, when you're not feeling good, you're emotional. That's the first place that happens. Oh, poor me, I got a sign. And this, Karen, this might be an injury, but I'm also talking about a sinus infection. You got your ears are clogged.
Yeah, I've done lots of poor me this last week.
Perfect, right? Like you dealt with
lots of poor me. I don't like laying down. I don't really like stopping. I don't really like resting. And I haven't always been happy about it.
Yeah. So I feel as I'm sitting here, like thinking about these things, why do we get ourselves in this situation? Why do we get into where we are so disconnected to our bodies and no longer have the patience for any of this? Because the big thing is that we need more, you need patience to heal. It's healing, time is part of the healing process. So, and I really think it comes down to 3 things. One, we have the unfair expectations. Yeah. And what I mean by that is like literally, oh man, it's funny. Literally, I have people be like, I took that vitamin yesterday, I'm not better. Like literally, and I'm not joking when I say that. I tried that.
I know. Yeah.
We have unfair expectations, and the expectation we have is that
drugs work fast, right? Like, like if we take a Panadol, the headache goes away. Like, or some Panadol, whatever it is, paracetamol or something.
Correct. That's the expectation that we have, that if I say, all right, I'm not feeling good, I have pain, I have a sinus infection, I want to take something and literally feel better by like the time it hits your belly. Yeah. That's one of the expectations that we have on our body. The second is, and I think this is a huge part of it, Karen, and it is what it is. I think we have become absolute wimps culturally across the world. I think everyone is wimpified. I think that nobody will sit in their pain anymore, whether it's physical, emotional, or spiritual pain. We have foregone the idea of learning. We've foregone the idea of learning a lesson in what we went through or how we got there. That I think we have been told you do not have to be in pain for a moment, not mental pain, not physical pain, not emotional pain, not depression, not anxiety, none of that. And I think we're so conditioned at this point that we're just not supposed to feel. And I look at it as a bigger problem, and a bigger problem. Like when I think of it, I'm like, man, our patience has run out. This whole COVID thing, if we really suck it up, like the fastest way through is everyone just get COVID. And like literally like there's no argument there. If everyone got COVID, a lot of people would be in a lot of pain, but then we get over it and the whole world would be healed. It would be done. We'd all have antibodies. Yeah. We're not willing to do that. We're not even willing to tiptoe into those waters anymore. So for us, the idea of feeling, but then learning in that downtime, in that distraught, I shared with you guys a couple of times about like the first 4 weeks of my knee injury, I couldn't talk about it. Yeah. Because it was distraught to me. So now, like looking back on it now, I learned a bunch of things. My wife and I were just talking about this an hour and a half ago. I'm still not where I want to be, but I'm in a different place. And really I'm spiritually with it. I'm a different place with it. But we're so conditioned not to tap into that. So I think that's part of it too. And then the third part of it is our tribes are so critical in our well-being, so critical. You need to know who your rock is, okay? You need to know that person that when you're on the edge, that person will make sure you don't jump off. What does that jump off look like? You got a little sinus infection going on. They don't let you go down the road of compromising your future because you're going to take an antibiotic because you feel a little uncomfortable today. That's what I'm talking about. listen, I'm not against antibiotics, but the havoc they've wreaked on our culture, and because I've seen the damage they've done in my own family, like, it's not okay for us to do that. And our tribe needs to hold us not only accountable, so there's an accountability, but in that moment, we're not looking for accountability. We're looking for leadership. We're looking for someone that's the rock that moves us forward. So I think it's important in this weirdest way of know who your rock is. Like, who's the rock in your life that if things aren't going good and you get, a little bit off kilter, who's going to make sure you stay on your path and not do something in an emotional state? And when we're in pain, remember, we are in an emotional state.
Yeah.
Pain sucks. Like, I don't care if you got, like, you had a head cold and a throat thing, like, and you were sharing with me off air that everybody wanted you to have a quick fix. And the challenge is,
haven't you taken cough syrup? Your cough sounds awful. Haven't you taken Panadol? Like, what, why don't you just take some Panadol? Well, we have Panadol. What do you have? Tylenol.
Yeah.
Yeah.
And there's this interesting part of that, the people around us trying to fix us. Some of it is out of true, genuine, I just want you to feel better because I love and care for you.
True.
And this
and also some people,
is all I know.
It is. It's all they know. 100%.
And there's another part, Karen, that we don't talk about because people don't want to talk about this part. But when someone's ill, it's very inconvenient for everyone else around them.
Yeah, it is. It's true. Yeah, especially if it goes on. Obviously, just had a head cold and this short term, but people, have real things that go on a lot longer than a week. I feel like a week is such a long time because I'm a wimp, just like what you're talking about. But a week isn't really that long.
No, it's not. So I guess those three things, and that's my little clinical tip for the week, is that we need a little more patience, and it's because we're up again unfair expectations. We are absolute wimps when it comes to most discomfort on any level. Like, someone hurts our feelings nowadays. We got this whole, what do they call it? The woke or something like that. Like, woke culture. Someone hurts your feelings and like you want to rip down the word. Like, that's what I mean. Like, we have these unfair expectations. We're completely become wimpy. And then the third part is that your tribe, like, know who your rock is. And that's important. A rock could be anything. It could be the doctor you go to. It could be your friend. It could be the book you read. It could be the prayer you say. It could be anything. It could be all the above. So I think dialing those in will continue to make health a lot simpler. Because here's what I discover every day that I practice for the last 25 years, that the human body is absolutely amazing.
Yeah, that's so true.
It breaks.
If we get out of its way.
Yeah, we got to get out of its way. We got to support it and do what it's designed to do. And we forget that the human body is the most significant, most incredible healing machine on the face of this earth. Everything about medicine is trying to mimic what the human body does. And it's trying to mimic it. It came like, we have the best drug companies sitting inside of our body. We have healing machines. We have bone remodeling machines. We have organ transplant, we have organ replacement therapy taking place in our body. We have hormones to produce, but we forget that our creator gave us this incredible body. And every day I get to practice I get a reminder, because I get those clinical insights too, but then I'll have someone being like, oh my God, I can't believe that, you gave me this adjustment. My nerves work better, but then my indigestion went away. Or I'm no longer constipated, or like my eyes working better. Like, I was like, yeah, I meant to do that. Like, no, I didn't. Like, it's just that the human body is so incredibly powerful, especially when we give it the opportunity to do some healing. So that's the sum of this is make it health simple, get out of the way, support the body, and let the miracles happen.
Yeah, and it's smart because it wants to tell you things. I mean, I guarantee it wanted me to have a week of rest, really. It's not unlikely that, I may have been pushing it and my body was like, you know what? Time for a rest. I'm going to give you something to be able to tell you that you need to chill out for a week.
Yeah. So it's kind of like this. We'll because we're laughing at you right now, we'll do that more.
Yeah. Keep going.
So like if someone comes in and be like, hey doc, every time I like walk, my knee hurts, every time I run, my left knee hurts. Well, so we'll stop running, right? Like sometimes it's that. So like if every time you go to speak, you cough, like we'll stop speaking.
Yeah.
Yeah. So yeah. All right.
Yes,
all right, let's move on. So that's a little clinical insight.
Yeah, it's very, very true. And I think, it's relevant to everybody at one level or another, or at one time and another. And sometimes we're better at it than others. We're better at sitting in our pain and listening to our body, and other times we're not.
Yeah, and patience. All right, let's dig in some of these questions. A lot of them.
All right, there is. Let's start with, what do ridges on my fingernails mean? Oh, that always makes me look at my fingernails.
Yeah, so everyone look at their fingernails right now. And fingernails tell a lot about health, and it also tells us a lot about like our gut health. So ridges, for the most part, think of ridges as B12 and iron. And those would be the ridges, like if I'm holding my nails here and I go side to side, and you feel like bumps and ridges and stuff like that.
Okay.
And just real quick insight on that. So I'll often see that for people that get a little bit older that are no longer absorbing nutrients that good, have some gut health, and iron is usually a part of this as well. So that's ridges, but then there's other things like you could have, so that would be going side to side this way. You could have it the other way, like white lines across there. That would be like a calcium deficiency. So the other one's like an iron deficiency, or and then you can have, I'm trying to think what else you see in your nails.
What if they're like really brittle? They start to kind of crack.
Yeah. So if they're brittle, what we should be thinking first is gut health. Okay. So like if your nails bend real easy, or they crack real easy, and are just like they were once more solid and now they're like flimsy, think gut health, because your gut absorbs all the minerals and all the nutrients, then it goes out. And that's one of the last places. And your fingernails are actually very vascular. And so they need a lot of good nutrients getting out there. And unfortunately, if they're starting to feel brittle, again, think B vitamins, specifically like biotin, what we use for our hair, skin, nails. That's why they always go together. Folate, same thing. You can have a lot of different anemias because of folate deficiencies. The reason I say gut health is if your microbiome is out of balance, we make a lot of our B vitamins in our gut. And if it's out of balance, not only are you not making them, but you won't be able to utilize those B vitamins. And then we see other things downstream. We'll see like your energy start to decrease, you lean toward carbohydrates, you start to get hungry after meals, you have midday yawning. Those are all in that category of like the B vitamin deficiencies. And that's what we use that one. It's like it's a full spectrum B vitamin called Cataplex B. And what's interesting, Karen, in that, one of the first ingredients is liver. So those of you that like to, like eat your vitamins, that's great source is liver. That's why I talk about liverwurst so frequently. I love it. Another one I should mention. So clubbed nails, those when they kind of fray up, and they'll be fraying up and they're brittle simultaneously. And in that scenario, we're really thinking about liver issues. We're thinking about liver, gut, maybe even heart gets in there as well. So the nails can tell us a lot. So if your nails aren't really super, and the cool thing is you can make some pretty significant changes, in like a 90-day window to your nails, which is really, really cool, especially if you clean your body up and get the right nutrients in.
And what about dots? That's another one that people have sometimes, like white dots.
Yeah, dots. So dots are interesting. So often that's zinc. So there's a couple different dots you can see. If you see like a big blotchy thing, if you have a moment, especially if you have a little insulin resistance. So in the lab work that we do, one of the reasons I tested, because insulin resistance can show up in many different things. But if you have like these big spot blotches, typically little spots you see frequently, they're more than one hand or more than one finger. Typically that's a zinc deficiency. Okay. But if you have these like big, like, I don't know, big isn't the right word, but like a little
more
like
blotchy
square.
or like
like a little square. Often that will be when you have infiltrated your body heavy duty with carbs and sugar. And it's almost like this impact that your body has where you don't absorb nutrients, you block everything out, and you can almost time it back to when you went like off the rails with your diet.
Yeah. Okay. Awesome. Okay. I think that's most of the fingernail things, isn't it?
Yeah, I think so. We covered spots, lines, ridges, so horizontal. Yeah, that's it.
Yeah, clubs. Okay, awesome. All right. Well, next question is, what to do for hair loss after having COVID?
All right. So this is coming up a lot. listen, I'm going to cover everything, like all these, a lot of the things that come after COVID, and the following, this is the kind of the following, and this has taken a little bit to understand yet, because we weren't really sure. Again, I'm gonna map it out like this. You got to cleanse. You got to clear out the body. During COVID, your body has basically a war. And the best way to think about it, so the war is that the COVID, we'll call it this guy, and then your white blood cell. And they go to battle and they beat each other up and they leave debris. And throughout your body, on all your cells, you have what's called receptors. And these receptors are a little like baseball gloves. And they all like different size and shape and angles and stuff like that. But you have receptors for everything, vitamin C and vitamin D and different hormones, your thyroxine, T4, like all that stuff has receptors. The challenge is what we're discovering now is that these receptors of the body have been filled with this debris post-COVID. Literally thousands, millions of cells being killed off. And a lot of it through your own white blood cells. And a lot of your receptors are clogged and blocked up. And they no longer can receive nutrients. So hair loss is very, like hair is very finicky. Like it's very, very sensitive to stress. You just went through physical stress, emotional stress. Everyone that got COVID was kind of scared. And then the last 2 years have been kind of chaotic anyway. So you definitely have the stress component. Hair loss in this scenario so we always think trace minerals when we come to hair, and especially things like zinc and copper and iodine and iron. Those are all the trace minerals. But now all of these can't get into the receptors to go feed the hair follicles. So some of the most important, again, go back to your B vitamins, folate or biotin, B7. And now all of these are being blocked out to getting there. So then your hair dies off and falls out. And we can restore. We've seen, what I've basically seen is a fallout in the people that cleanse themselves. But you're going to have to do a deep dive. So for Karen, for example, we're doing our cleanse in January.
Yes, we are.
If anyone who's listening has had COVID or had hair loss and you were looking what to do, join us for the cleanse. We're going to kick it off on January 3rd. Be awesome. In fact, Karen, if you have a link or something, maybe you put it up.
Yeah, so registrations have just opened, guys. So you can go to drbartcleanse.com. I will add the link in the chat for you, but registrations have just opened. And to get your stuff on time this year, we'd love you to jump in as early as possible, right, Dr. Bart? So that we can make sure that you get, because there's a bunch of supplements that we send out, protein powders, all this stuff. So we want to make sure you get your pack.
Yeah, 100%. So if you guys are like thinking, I know, the holidays are here, these next 45 days are going to be what they're going to be. We're going to hold the line, but January 3rd, let's draw a line in the sand. That's when we really like hunker down and say, all right, I'm going to draw a line in the sand and make this the best year of my life coming up. So, and say, just like Karen was saying, this year, I suspect shipping and all that kind of stuff is going to be backed up a little bit. So get your orders in early. There is like an early bird special, et cetera. So, and we'll put a link and you guys will see and hear more from us, but let me go back to the hair for a second, Karen. Yeah. There's more to it. And I think what we saw is COVID exacerbated a lot of conditions for people. Okay. So, and it wasn't just because of the virus. I truly believe it was the virus with the fear. Yeah. So if you had a little bit of leaky gut, if you had a little bit of SIBO, if you had a little bit of candida, if you had a little bit of IBS, COVID.
Most of us do have some sort of that, right? Like we beat up on our guts for a number of years.
Oh, absolutely. Our guts are probably still at this point, I think they're the most undervalued part of our health. And I'll dive into that in just a moment. But if you've had any of those things like lingering, the COVID then exploits that and exasperates those conditions. And what that really means to you is, in going back to hair loss is almost always related to either stress or your gut, that those are the primary things. And when we think about the vitamins, the biotin and stuff like that, the deficiency is not because you all of a sudden change your diet, but because all of a sudden your body can't absorb those nutrients. So we got to go back and heal that stuff up. So all of those things. And then on top of it, for a lot of people, part of the protocol was erythromycin. So if they got COVID, they went on a round of antibiotics. And again, we cannot discount. I don't care the reason we take them. Antibiotics are so destructive to the microbiome in our gut, so destructive. They always, not sometimes, they always cause a level of dysbiosis, which is an imbalance between good and bad guys. And if your good bacteria are not flourishing, you're not going to absorb your B vitamins like you did the week before you had those antibiotics. And that's your B vitamins. Those are things like biotin. So do I see all kinds of challenges happen after antibiotics? And listen, I'm not against them. I still think in the big picture, there's some of the
times that you need them, right? Like, or well, not need, but yes. Well, sometimes they're definitely the course of action to take. Yeah. If you're in, things happen, you're in hospital, they're life-saving. We just use them too much.
Yeah. I think they should be reserved for what we call emergency use.
Yeah.
So next time you have a sinus infection, you got to ask yourself, is that an emergency? No, just really uncomfortable. And there's a big difference. And when we start to listen to ourselves and ask the right questions, have a good try around, because they're never forgiving. You always have to pay back. So I guess to the hair loss, clean the body out, do a cleanse, clean out those receptors. So then as you start to refeed your body, you can get those nutrients back in there, and then the body can bring them, your bloodstream, et cetera, can bring them into the areas that need all those little micronutrients, especially things like the trace minerals that I discussed, the iron, the zinc, the copper, the iodine, all of those things that help us grow hair. And then also things like the B7 or the biotin. So those are all helpful. If you're already doing those and they're not working, you got to go clean the whole system out.
Yeah. And really focus on your gut as well.
Yeah. So Karen, the gut health, literally it's 70% of our immune system is in our gut.
Yeah, I hear that. But what does that mean? Like, how is 70% of our immune system in our gut?
Okay. Good question, because I don't know if everyone, I know I've said it all the time, but no one ever questions me on it. But they should.
Yeah. Yeah. So we just take it. Yeah. Yeah, it is. But what does that even mean?
Yeah. Because I think people will then be like, well, my gut feels good. Like, I don't have, you know what I mean? Like, I poop fine, or
I don't have diarrhea. I'm not,
And those are just some of the symptoms. But so what it is, it goes like this. You have what's called the microbiome. And just think gut flora is your good bacteria and your bad bacteria. Literally, we house millions of different types and strands and diversities of bacteria. And this bacteria, in turn, protects us. So what happens is you have what's called lymphoid tissue in the intestinal region. That lymphoid tissue, remember, lymph is where the white blood cells hang out. That's your immune system. So literally in your gut, you have T cells and you have antibodies. So we're talking all about these antibodies. Where are the antibodies hanging out? You have antibodies in the lymphoid tissue in your gut. So when a bad guy gets in there that's been there 10 years ago, those antibodies go, no, I saw you 10 years ago. You are not allowed here, and it attacks it. Maybe it's a little uncomfortable and you get diarrhea that day. Maybe it's a little bit uncomfortable, but your antibodies are going to do their job because you have a good mucosal lining. That's the lymphoid tissue. Golden seal, we talk about that as a good herb to help, improve that tissue. And if you have those antibodies and your body's ready prepared, it goes to war for you, kills off parasites, kills off the bad bacteria, does all the unwanted jobs. The challenge is this: when you take things like GMOs, there's a reason I talk about GMOs so much. It decreases the amount of lymphoid tissue you have. So now you don't have those antibodies. They have nowhere to go. They need that lymphoid tissue. They're not just circulating around. They need that tissue to hang out in. And if that lymphoid tissue is broken down, tissue is dissolved, is broken up, bye-bye. You don't have those white blood cells in your gut. So what that means is when we take antibiotics, decreasing the immune system. That's first line of defense. Everything's coming in and getting into the gut one way or another. So when we take antibiotics, we kill off that part of the microbiome. So that's real. We don't have that discussion often enough. It is not uncommon. So we see this in our dogs a lot. So we have a lot of dogs. We get a lot of experimentations going on. A couple months back, my little boy, Toby, who did a cameo about a week ago here, but only lasted for like a minute.
It wasn't long.
Yeah, it wasn't long. So he likes to fight with the bees outside and fight with the ants, and he always loses.
Yeah, that's not
ideal. He goes up and he gets literally he goes into this anaphylactic response, and it's crazy. It's so in those scenarios, We need medical intervention. Hopefully my wife is nearby and get all my dogs here. We need medical intervention. And in those moments, this is probably 8 weeks ago, maybe a little longer than that, Toby got some antibiotics.
Yeah.
And listen, like clockwork. For the dogs, it takes about 6 to 10 weeks and they'll start itching.
Wow, really?
They start to come up with yeast.
Yeah.
And it was so interesting because it's just like we talked about opening the show here with the patient and, and knowing our body and understanding all that stuff. So we had to do that. But because he wasn't in pain, we literally didn't do all the things that we normally do to rebuild the microbiome, knowing that the antibiotic crushed it. We talked about it. We just didn't do it.
Yeah.
Now he's back on a protocol that we would put an animal or a human on. Anytime you take an antibiotic, you got it on a protocol, you are going to pay down the road. So our little boy, Toby, who's eating the same food for the 2 years he's been alive, a lot of variety of vegetables. He's on a carnivore diet. It's awesome. Eats better than most human beings. It wasn't his diet that was creating this, but now he's got these itchy arms and everything. And sure enough, like clockwork. And humans, listen to me. Humans listen clearly. You go on antibiotics. If you've taken enough, oftentimes it'll start to bother you when you take them, like 2 days later, or different ones will bother you. But it's usually about 6 to 8 weeks when you get the gut bloating and the weight gain.
Yeah.
Mark my words. Just mark your calendar next time you do it. People are like, but doc, I had a runny nose. Yeah, I get it. And a lot of people that I see, I can we have good enough relationship where I can poke them a little bit. I'm like, really, you dying today? Because you want to be able to have that antibiotic if you are. You want to have that access. You want to have something that works for you. I don't know, 10 years ago, I got bit by this spider, started rotting away my skin and everything, and they pumped me with antibiotics and it worked. And I hadn't had an antibiotic in probably a decade or two. And that was the last one I had. But sure enough, my gut was a mess for almost a year. But that, I was like, I'll keep my leg. That's cool. And I'll fix up my gut.
Same. I cut my foot on some coral when we were in the Cook Islands. And I was like, that's fine. And then I watched it and it just got bigger and bigger. I drew a circle around it to watch it. Because I was like, that's not healing. And I put a bunch of stuff on and took a bunch of supplements. Okay. In the end, I was like, I guess I need some medical help. It was just something was getting bigger, right? Antibiotics. Yeah. I mean, it stopped around. This was probably 10 years ago too.
So, back to the whole gut here. What do we do when we notice those things are starting to go? One of the biggest things I think we need to do right in the front, without me going into a 4-hour deep dive of microbiome, is this is how simple it really is. Eat a variety of vegetables.
Yeah.
All right. When we eat fiber, especially insoluble fiber, those are the prebiotics. Then we want to get in a variety of different fermented foods. And literally things like kombucha, things like sauerkraut have more diversity. They may not have a number of individual ones, but they have more diversity than probiotics. And listen, I've had what I consider some of the world's best probiotics. I have one that's a combination of a pre and a probiotic called ProSymbiotic. Phenomenal. I use one called Zymex. It's a wafer. Any post-antibiotic use or during antibiotics, immediately start to go on that. Yet ultimately, in the big picture, we have to have that diversity. And one of the challenges is that our diets, we eat the same damn crap all the time. Yeah. And we eat from the same places all the time. So that's where getting it as best you can, from farmers that, are using things, they're just different farms and stuff like that. So increasing the diversity, absolutely critical and, important. And that is one of the things that we never discuss when it comes to weight loss is microbiome. Yeah. If you don't have a healthy gut microbiome, very, very difficult to lose weight because that's what your metabolism is. That's who eats your food. And if they can't eat it, because they're not there, then your bad guys eat it and your bad guys hold it. They don't assimilate it into vitamins and nutrients. So if you're out there right now and you said, you know what, I did paleo before, I did keto before, I did, vegan diet before, and I lost all this weight. And then something happened. I got sick. Maybe I went on antibiotics. Now I went back to keto or something. Now it doesn't work for me. Yeah. That's where we got to look back and be like, man, what else was different? but we often don't think about those other things. We think maybe just the diet. So how do we fix this? The simple thing when it comes to gut health: diversity. And on many, many levels. And listen, in expanding our palate so we enjoy things that aren't just sweet and salty. So getting in the bitters and getting in the sours, some of the savory type stuff. That's when we expand our capacity to break food down and to increase that microbiome and literally increase the amount of lymphoid tissue in there. Because that's where those white blood cells, that's where those antibodies will live. Those of you out there that have autoimmune conditions, I don't care which one it is, know that started in your gut. That was almost all autoimmune conditions, almost all are something to do with your gut and the inability for you to have, or the bad microbiome or the bad bacteria overwhelming you the good bacteria.
Yeah, no, and just speaking of weight loss, I mean, they did that really interesting study. You would have seen it with the rats, right? They took 2 rats, they fed them the same, but they gave them they were talking about fecal transplants. So somehow they gave one rat like a obese person's microbiome, the other rat was like a skinny person's microbiome, and regardless of eating exactly the same thing, one rat got fat and one rat didn't. And it was all based on the microbiome. They were looking at how they could use fecal transplants for things like weight loss, but it was amazing. The microbiome of these rats determined, with even doing exactly the same thing, determined whether one gained weight and one didn't.
And that's one of the things that, for a lot of us that are working in the clinical space and helping people lose weight, there's not a cookie cutter, like one size fits all. This is, an individual basis, and every case is a little bit different. And and again, it's not that any of us that practice where are anti-medications, but that is part of your history. That's what makes up your microbiome, and speaking of what makes it up is the good guys. But let me at least talk to, because we're in the season out here, we're going into Thanksgiving, then into the Christmas holidays. This season, these next 45 days, is when we really beat up our gut. So these are the things, Karen, that are probably most significant to destroy our gut: alcohol, stress, sugar, and antibiotics. And all 4 of those will be rampant in the next 45 days. Yeah.
It's like the biggest time of the year for them.
Yeah. So, so that's, if we have a little bit, everyone listens to it. So just be mindful. Like, we know these things are coming. So that'd be a good idea for you to say, I'm going to hold the line for the next 45 days, draw a line in the sand, January 3rd, let's all cleanse together. And that's the difference too. We talk about the cleanse a lot, but it's not just a food change. Like, the food change is the easy part. We're going to eat real food for 10 days. I have you basically act like a vegetarian. I take out some of the inflammatory foods. And this is just a live and learn over the last 12 years of doing this. Yeah. In that time, the real magic is the rehabilitation. It's the supplements we use to get your system back on board. Things like your liver and your gallbladder and your pancreas and your stomach and your lymph. So all of those things are what we're really rehabbing. So then when you're putting good, real nutrients into your body, you become awesome at bringing them back in, the nutrients into the body, so you can make better and better cells. So you move closer and closer to be superhuman.
And we're going to do live calls and things again throughout the cleanse, so people can ask their questions and get their tribe and support and all that good stuff.
Heck yeah. That's half the fun of it. And I really think one of the reasons that we have, like, in the people that are participated, they feel the same way. I think the big part of the reason that we have so many people with so much success is that tribe.
Yeah.
Because it just makes
the Facebook group gets awesome. Everybody's helpful. Everyone's sharing recipes. It's awesome.
Yeah. And it's just, no one wants to be restricted as an adult. Like none of us, we're not good at that. But when we're in a tribe and we're kind of like, we're all in it together, and we're like, yes, like, we're drawing a line in the sand, and I think every year the consciousness of it grows. And that's one of the things that's been exciting over these years, where I feel like, even though COVID has taken its toll on some, people emotionally, I've also seen like some really good things, like the consciousness of people. Not everybody, but for a lot of people, have really learned this year. They learned more. Like, I learned more about like viruses than I ever wanted to learn in my life. So all right, with that, let's dive into some more questions. I know we're running.
Okay. Next question. Okay, I've got an 18-year-old family member recently got out of the hospital being treated for mono. What supplements would help heal her body?
Okay, so they're in a hospital for mono. I mean, they're a pretty bad case. So
Not a bad case.
yeah, mono's a virus. So
Yeah.
this Karen and whoever's asking the question, this is the self-pathogen protocol. It was made for Epstein-Barr. That's a mono is an Epstein-Barr virus.
Yeah.
So yeah. And listen, the nice thing about the Epstein-Barr virus, they don't have to have a perfect diet on it. They don't have to do all those things, but that's what you want to do. And the sooner the better, because the longer that virus lives in the body, the more it learns. It's a stealth pathogen, very, very intelligent, and it'll learn uniquely how to hide from the white blood cells. So, man, it really, it's there to survive. So the stealth pathogen protocol, it's where we use a pulse dosing with 4 different herbs. Very, very effective. It is so grateful to have this protocol now where, literally for years, it was a huge, huge challenge to help people with mono and these other things. But I'd also say if you had mono, probably the self-pathogen protocol combined with a little bit of a liver cleansing or using something like Spanish black radish. Now, if you're in a hospital, I know they're on antibiotics. So we got to get Zymex, which is the one that we're going to use, that probiotic that we use directly after any type of antibiotics. Just go through 1 bottle and make sure you're getting that good bacteria back in there. And if this is your family member, as a tribe member, pay attention, because after they're on all those medications, the digestive system is not as strong. And therefore that individual tends to lean away from all of the animal foods. Red meat, chicken, turkey, all of these different things, and starts leaning toward carbs and sugar because that's all they can break down. And this is not a good pattern. So all that being said, if you need me, I'll be happy to help. But if you just started there, you'd be in a great place.
And if they want to do the stealth pathogen protocol, reach out to the Balance office.
Yeah. Just call our office. My crew, who's absolutely awesome. High five crew. They'll be glad to help you. And what they'll do is they'll time when you're going to get the protocol itself, like physically in hand, and they will then send you a calendar based on that start date. That's probably the hardest part of it, because you're going to take 2 of them for 4 days, 2 of them for 10 days, and you go back and forth over 90 days. And so it's not a lot of things, but it's like meticulous how you need to do it.
Okay. Yeah. Awesome. Okay. I have another question here. My daughter had a partial thyroidectomy today. Her thyroid functions have been fine. She had a mass growing there, hence the removal. What can be done to maintain healthy thyroid function?
Well, I suspect if they took part of it out, they've already put her on meds, is my suspicion. You're going to need a minute to find out. So if the surgery was today, you're probably going to need a good solid 30 days to help that gland to kind of like balance itself out and see where it lands. I would probably test, and there's, you want to test the whole spectrum there. When I say the whole spectrum, there's about 9 different markers to really know how that thyroid's functioning. So that's where I would start. I would give it about 30 days and probably run another test, just a thyroid panel, like a complete thyroid panel. And then from there, based on those results, that's where then you can then determine what's going to be next best. So good thinking, right? So we're not going to just, I had a surgery, the problem's gone. No, like I had a surgery. Now, how do I help the body from whatever it was before and from that surgery? So yeah, no doubt they're going to need something called thyrotrophin PMG, which they can start immediately, because that thyroid gland has been damaged. And now we want to help heal up the gland itself. And it sounds, when I say damaged, like it was intentionally damaged, like it was surgically partially removed. So, but that's still damage according to the human body. If you stick a knife in it, it's still damage.
Yeah, for sure. And what was that one?
Thyrotrophin PMG.
I don't know if we have.
Thyrotrophin PMG.
Okay. Yes, I've got a link for that one. So they can start that right away.
Yeah, 2 before bed on an empty stomach.
Okay. All right. Next question. After exercise and walking too much, I get cramps in my toes and my calf. What can I take to relieve the cramping?
All right. So, a couple things. Let's rule out some of the simple things. I'll be blown away how many people's shoes are just too tight. So let's just make sure
Ah,
that, and especially that top lace, let's just make sure you're not choking anything out.
yeah.
Um, let's also be smart too. So remember, your toes and your calves are the farthest from your heart. So they're
Mm.
getting the least of everything. And especially if there's any limitations, if you're too tight, like your legs or your hamstrings, your quads, so make sure you stretch out, they increase the blood flow. Absolutely. There'd be two things though, that typically cramping, you're going to look at magnesium first. And that's something you want to take at night. It's a yin mineral. There's also something called Cataplex G. I don't talk about this one too much. It's in the B family, but it's really vitamin G, and it's a
Yeah.
vasodilator and works wonderful, especially if you have if there's any restless leg syndrome taking place, their legs are fidgety at night, or you're cramping at night. Usually, a magnesium and or Cataplex G will do the job. If you choose to get those, just reach out to our office. We'll give you the dosing for it. With that said, do not rule out, like if you're not stretching, you can't even have this. You're not even allowed to ask this question if you're not stretching already. Yeah.
What about, do people say that cramping's from dehydration? Is there any truth in that?
Yeah. But usually that's like a blatant obvious thing.
Yeah.
Yeah, typically and the first part of dehydration is fatigue.
Okay. Yeah.
Yeah. So there's usually fatigue. When I hear it's in the toes and in the calves, it's farthest from the heart, and there's most likely a nutrient deficiency. But again, you can choke it out. Like you can just have too tight of hamstrings, too tight of quads.
Yeah.
And
Which,
too
a
tight
lot
of,
of us have, right?
yeah. Mhm.
Yeah. Cool. Okay. Awesome. Okay. Next question. How do you find out the correct amount of protein to consume every day?
Good question. I tell you what, there's not a one size fits all here, and it's so important that we understand that. I grew up in an era where it was, if you wanted to be huge, like Arnold Schwarzenegger, which that was the bodybuilding era, and everyone basically just fell in line with 1 gram of protein per body weight. Now, clinically, that is not what I suggest. I think it's way too much. I don't think we metabolically are built for that. There's been really some good research. Dr. Mercola did some really good research. Well, I don't know if he did the research or I read the research that he found, but they did some really good things where if you can figure out your lean muscle mass, and I have a machine that does it, so that's kind of convenient. If you're near my office,
Yeah.
if you're near my office, you live and come in anytime. There's no cost. You just take your shoes off, hop in the machine, it does a body composition. You'll get your weight, and then just to the left of it, it'll give you a lean body mass. If you take that number, divide it in 2, and that's so my lean body mass is, I think, 100, almost 130 pounds of mean ass muscle. I'm just kidding.
Okay.
If you take that, cut it in half, that would be your benchmark on a daily basis. So it put me in about the 60 grams, 65 grams. If you train really hard on some days, you do CrossFit, you're breaking down tissue, you might double that.
Okay.
But I've yet to see anything that is legitimate biology that says you should be doing 1 gram per body weight. And the challenge with this, Karen, is that if you take in more protein than your body can use, you store it in your liver, and your body goes to what's called gluconeogenesis, and it turns it into sugar. So excess protein is hard to break down. So excess is excess. And if you have too much, most likely it just converts to sugar. Yeah. And I said what I just said. Yes, protein converts to sugar in the liver. So if you have too much of it, that's exactly what it's doing. I have found that I've been able to put on muscle mass if I want, and lose it too if I don't want, without eating nearly as much protein that I thought I had to do in the past. So most days I'd be surprised if I get 60 grams of protein. Now, that being said, I'm talking about counting, like if I count up, like what did I eat in animal proteins today? The chicken, the fish, the egg. I rarely count how much I'm getting from vegetables, and you do get protein from vegetables. So I'm probably discounting a lot of the other proteins that I'm getting in my vegetables, but nonetheless, I don't think there's a single answer for that. And I don't think there's one size fits all, but if you are near my office, come on in, hop on the InBody. It's called an InBody test, and you'll find out from there.
Yeah, love that. Awesome. Very cool. Well, we are we're almost out of time. So I'm going to move on to our last question. What is the one action that our listeners can take to move them towards their goal of becoming superhuman?
Well, really what I want to say is just don't be a wimp. But I won't say that. Really what my thing is going to be, know thy body. I think the more we learn about our bodies and the more we get to know our bodies, that is really part of being superhuman. And I think, especially we're going into the holidays now, and for us to like really do a gut check and be like, where do I want to be in the next 3, 4, 5, 6 weeks? So I want to be working from a deficit and out, like out of a hole, or am I going to do something a little bit different this year? Know my body, listen to your body, do what serves your body best. So the answer to that one is to become superhuman, know thy body.
Love it. Awesome. Well, thank you so much, everyone, for tuning in. We'll see you back next week at the same time, same place for another episode of the Health Made Simple show.
Yes. And of course, everyone, awesome having you here. Keep doing your thing, keep sharing it out, keep spreading love, keep making health simple, because it really is. And of course, we're going to take deliberate action for our mind, our bodies, our overall wellness. Y'all be awesome.